This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
As
Supposed to
second.
help first or
Medical Dilemma.
Hi, I'm Sunny Del Rosario and you're watching Medical Dilemma. Ultrasound technology has become so advanced that it's now possible to see what's inside us in virtually high definition. What a perfect plaything for this selfie-obsessed generation. However, is it as safe as we perceive it to be? Our guest for the first segment is Dr. Lyra Ruth Clemente Chua, a specialist in obstetrics and gynecology with subspecialty in reproductive endocrinology and infertility. She's a member of the EXICOM of the Medical City, Department of OBGYN, and head of the Women's Healthcare Center. She's also a fellow of the Philippine Obstetrical and Gynecological Society and a past president of the Philippine Society of Reproductive Endocrinology, Philippine Climacteric Society, and Philippine Society of Ultrasound and OBGYN. Okay, welcome to the show, Dr. Chua.
Thank you. I'm glad to be here.
Yes, we're also very honored to have you on the show. For the benefit of our audience, let's talk first about the basics of your specialty. Okay, so what exactly do you do in your specialization?
With obstetric and gynecologic ultrasound, we use the ultrasound machine to look into the body of the woman, and if it's a female patient coming in with a pregnant female patient, then we look into the uterus and see what's inside, the pregnancy. We see how well the pregnancy is, we see how the fetus is doing, and we are also able to see whether there are any abnormalities in the fetus. Now, if the woman is a gynecologic patient, meaning she's coming not pregnant but with problems about her uterus and her ovaries, then we could also take a look inside and see whether there are tumors, there are masses, or there are other abnormalities that result in the symptoms of the woman.
Okay, is ultrasound only useful on women or can they be used also in men?
Well, ultrasound is being used now for everything. We do ultrasound for kidney problems, for renal problems. We do ultrasound for breast problems, female and male. And then males also need to go prostate ultrasound, liver, kidneys, pancreas. All of these are being seen these days with ultrasound.
And these things can be done by the same ultrasound machine?
No, by the same ultrasound machine, but you need specialized probes. Now, the probes are the instruments which are put on the body. Like if we do breast ultrasound, we have to use a different probe from the ones we use for transabdominal ultrasound or the ultrasound used to look into the pregnancy.
I see.
Yeah.
Now, going back to your specialization, what are the typical cases that you encounter in your everyday practice?
Well, the most common ultrasound requests we have are ultrasound for the pregnant woman. So we usually do routine scans now during the first trimester to establish the actual age of the fetus, to know the exact date of delivery, and to see if there are any abnormalities that could be identified during the first trimester. Then the next common ultrasound request is during the second trimester. If the woman has not had a first trimester ultrasound, then definitely she should undergo a second trimester ultrasound with the same aims, to establish actual date of the due date of the fetus, the actual age of the fetus, and any abnormalities that may be seen more clearly at this time, like fetal anomalies, congenital anomalies, placental abnormalities. It's very important for us to establish where the placenta is at this time. Because a placenta that's implanted low, we call that the placenta previa, could result in bleeding disorders. And this woman has to be delivered by cesarean section if that is seen by ultrasound.
When you say the placenta is low, does it mean that the position of the placenta is somehow
Abnormal.
blocking the baby's path out of the
yes.
human body?
Yes, it is an abnormal place for the placenta to be. Normally, the placenta is located at the top of the uterus,
top,
and it's the
okay.
baby that needs to come out first.
Yes.
If that placenta is down there, it would block the baby's head coming out, and that baby will not be delivered, will never be delivered normally. So that will
see.
that baby
I
will have
see.
to be delivered by cesarean section.
I see. Okay, now what about cases that are not connected to pregnancies? Okay, what do you encounter?
The most common would be for us to see whether there is indeed a myoma. The
Myoma.
myoma is the most common tumor of the uterus, and the physician would ask for this if during the internal exam or the physical exam of the woman, the physician, the gynecologist feels a big uterus, a uterus that's bigger than normal, than the normal non-pregnant uterus. So to confirm the presence of that tumor, an ultrasound is usually requested. Or if the clinician also feels something on the side of the ovaries, then the ultrasound is also used to confirm the presence or absence of an ovarian cyst or an ovarian tumor. And of course, when we talk about tumors, when we
Yes.
talk about cysts, the fear, the most, the fear of the clinician and of the patient herself would be cancer. So somehow, with ultrasound, we are now able also to somehow distinguish between a benign tumor and a malignant, tumor, which is the most important part of the ultrasound.
So there are differences in appearance between these two
There-
tumors?
we go by several standards, guidelines, which will tell us whether this is a benign tumor or this is a malignant tumor. So we have what we call the M rules and we have the B rules. The B rules are if they fall under those rules, then they are benign. If they fall under any of the 5 M rules or the malignant rules, then they're classified as malignant.
Okay, without going into too much technicalities
Yes.
or medical terms, could you give us an example of distinguishing between a benign and
Yes,
a
okay.
malignant
One
tumor?
very common way to distinguish is if the cyst is just one locule or just one
One
big
mass.
cyst, one mass,
Yes.
and the contents are black. No, they are. We call them anechoic. On the machine,
Anechoic,
they're all
yes.
black. Then that would classify it more as the benign tumor. Now, if the tumor has many, we call them.
Like scattered?
Locules, we call, if they have many rooms, no, like if it's one big house and it has many rooms, it has many locules, we call them locules, then this
okay.
would be more of the malignant type. Or if we see a solid area or a white area within that cyst, then it would be classified more as malignant.
Okay.
And even just by the roughness or the irregularity of the tumor, then that would be, tell us it's probably more malignant than benign. Because a benign
Okay.
tumor would be very smooth,
Smooth.
very clear lines, very precise lines.
I see, I understand. Now, how reliable is the interpretation of tumors using ultrasound?
We don't pretend to be exact. No,
Yes.
there will always be room for
Error,
errors.
yes.
And so therefore we usually say probably benign or present sonologic findings are suspicious or
Suspicious.
are highly suspicious for a malignancy. And then we would say please correlate with your clinical findings and with other ancillary laboratory findings.
Okay, so
Yes.
you will never say that
We will never
this
say
is,
this is benign or
confirmed
this
as
is
benign
yes,
or
yes. We will never say
malignant.
that because there will always be errors. The interpretation will not always be correct.
Now, I remember the first time I encountered an ultrasound machine, the pictures were sort of totally black and white and
Yes.
very grainy.
Yeah.
Okay, and I guess it's because it uses sound waves
Yes.
informing the images inside of our human bodies.
Yes.
Now, what developments have arisen in the field of ultrasonology?
Well, yes, technology-wise, ultrasound has really grown by leaps and bounds. In fact, now we already have very clear images of what we see inside. The fetus could be seen very clearly. We now are able to do 3D, three-dimensional pictures.
Three-dimensional.
Yes, of the fetus, meaning it's just like you're looking at a picture
A
of
still
the
picture.
fetus. And then 4D, when we say we also do 4D, it's just like you're doing a video of the fetus inside. So you see that fetus actually moving in real time. It sticks out its tongue, it does close open of the fingers.
Really?
You see everything. It breathes in and breathes out. Sometimes it yawns. No, you see everything. It blinks its eyes. You see all of those now by the 4D technology of ultrasound.
And the image on screen is
And we capture
really
that.
3D.
Yes, yeah. 3D, 4D. We capture that, and this is what we give to the patient. No, it's just like giving a video clip of the baby to the patient, and they really treasure this.
I see. So that's very interesting.
Images.
So you can actually keep a
Yes.
video of your
Of
baby,
your unborn baby.
even before
very,
it's
very
born.
clear, yes. Of course, not all patients coming for 3D, 4D ultrasound will go home with that clear picture, because it now depends also on whether the baby is facing the camera. No, just like
Okay,
an
so
ordinary.
it could be
Yeah,
that the
yes.
baby's not facing the
It's
camera
not
at all.
facing, or there's no clear outline of the face because there's a very little amount of amniotic fluid, so that would not give good pictures on the 3D ultrasound. Sometimes the baby is turning its face away, or the baby is kissing its placenta, so there's no way that baby will be seen very clearly by ultrasound.
So I guess because of such developments in ultrasonology, it's now much faster to confirm the sex of a baby.
Again, I could say yes to that, but again, it now depends on the babies. There are babies who really close their legs when we
Yes.
try to look at whether they're boys or girls. And so again, it's not always a 100% thing. When the patient, Doktora, makikita na ba natin yung sex ng baby? It depends on your baby, whether your baby is going to show it to us. Because some
Okay.
babies really, parang just like, you know, babies,
with-
when you
with closed
take a
legs, you
picture,
really can't tell.
they turn away from you.
Yes.
The babies also do that.
They do that.
So sometimes I tell the mother, kausapin mo na yung baby mo, so your baby will show us what we want to see.
I
So it would now just open its legs, and you would see it very, very clearly. In fact, by about 12, 13 weeks, first trimester, sometimes I could already see the sex of the baby.
In the
As early as
13th
that,
week.
yes, as long as the
That's
baby is...
pretty early,
Yeah,
yes.
that's pretty early.
I see.
The most common would be about 18 weeks, about 5 to 6 months.
Okay. Now, how frequently is ultrasound used as a diagnostic tool in your patients?
It is now the most commonly requested diagnostic tool in the OBGYN patient. No?
Okay.
In fact, sometimes I would say it's now being overused or being abused, because sometimes clinicians, without even examining the patient, they would already send the patient to the ultrasound unit for an ultrasound. No, they don't. Patient comes in bleeding, abnormal uterine vaginal bleeding, goes straight to the ultrasound. They don't even bother to examine the patient anymore and do all the necessary speculum exam, bimanual exam,
Okay.
all of those things that we were taught to do before sending patient for diagnostic imaging.
Okay, well, that's something surprising.
Yeah.
But before we discuss the details of this case, we'll have to take a break first for a few words from our sponsors. So please be right back after a few words from our sponsors.
Okay.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place. or anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other